the vaginal symptoms will eventually go away on its own. This is not true. Unlike your hot flashes or mood swings, irritability, the vaginal symptoms will not go away. It will become worse without management. And you might have a permanent decline in function, either sexual function or bladder function or bowel function. Once again, jy mag nie 'n ou vrou met 'n nat broek wees nie.
Hi there, I'm Shanine. As a certified health coach and kinesiologist, I help busy women in their 40s who feel tired, overwhelmed, anxious, frustrated and stuck to live their best years in great health and balance. Together, we'll explore a life that reflects intentional living and lays the foundation for you to live your life's purpose and flourish in your 40s. Welcome to Becoming You at 40. Today's episode is one I've been wanting to record for a long time because it covers something that affects almost every woman, yet is still so rarely spoken about openly. Today we are talking about vaginal health in perimenopause and menopause, what changes, why these changes happen, what's normal, what's not normal, and most importantly, what we can do about it. And joining me in today's conversation is Dr. Bianca Zondach, a gynecologist who specializes in caring for women in their 40s and beyond, with a deep focus on perimenopause, menopause, and quality of life. So Dr. Bianca, welcome to today's show, and thank you so much for being here.
What a pleasure, Shanine. Thank you so much for inviting me.
We had a conversation a few months ago and we did a deep dive into perimenopause and menopause. Yeah, and I just wanted to give you some feedback because
thank you.
Yeah, the episode was so welcomed by the listeners and it was so informative and I think it made them feel empowered.
Oh, that's wonderful to know.
Yeah,
yes.
And I can't wait for today's conversation because now we are stepping away from the normal narrative of just hormonal changes and we are going to do a bit of a dive into the vaginal changes that we experience.
Very important.
Very important. Now, just before we begin, I would like to invite the listeners to please follow this podcast. If you are hungry for information and need sound advice of how you can manage this phase of transition, then this is your space. So please hit that follow button and please share this podcast with other women that also need to know what they can do to take care of themselves during perimenopause and menopause. Dr. Bianca, let's start with the big picture. What are the most common vaginal and vulvar changes women experience during perimenopause and menopause, and what causes them?
So when you say most common, I want to tell the listeners it's not most common. This happens to everyone. Okay. The first thing you can expect is vaginal dryness and atrophy. So the vaginal walls become thinner, less elastic and drier because it loses moisture and the tissue thins due to a lack of estrogen. A consequence of this dryness and atrophy is painless intercourse, or what we call in the medical world dyspareunia. So when you develop atrophy, you will have reduced lubrication. As the tissues thin, it becomes very dry, and with then sexual activity or intercourse with a partner, it becomes very uncomfortable, and you will experience a stabbing or burning pain. I want to just say to listeners that the vagina is a potential space. It is not a big gaping opening, but it's got very elastic tissue. That's how it allows for childbirth. You can literally push a watermelon out of there. And that's how it allows for sexual intercourse when there is penetrative sex. This elasticity, when it's lost, will leave you with a potential space that doesn't open and the tissue gets hurt.
Okay.
So on the vulva side, the tissue also thins. So the vulva has got an extra special soft fat padding, and that we lose, and the lips or the labia becomes very thin, and we also get discoloration. Some patients it becomes darker, can have a bluish greyish tint, or some it becomes very pale and white. In some patients the labia can, especially the inner lips, can completely disappear and go away. And that labia must actually protect the entrance of the vagina and keep it moist, and it can disappear and go away. So itching and burning is something very commonly experienced due to the atrophy, and it's mostly because the dryness. It will experience chronic irritation, burning and itching, not necessarily due to infections. But we do see an increased amount of infections during this time because the mucus or the moisture of the vagina is a barrier or a protective layer that sort of, in a way, traps bacteria. Now your own bacteria gets easy entrance into the tissue itself, does not get trapped, and you get spontaneous infections. So the infections you get is not necessarily sexually transmitted or to do with any form of hygiene. It's because you've lost your protective layer of mucus.
Okay.
Then urinary symptoms, very common. The lower estrogen causes thinning and laxing of the urethra, which is your little bladder pipe where the urine comes out. So, which can lead to increased urgency. It doesn't close as tight, so with a less full bladder you will have an extreme urge to go because it doesn't hold as tight or pinch as tight anymore. You get frequency of urination for the same reason. Even with a half full bladder, you feel you can't hold it, so you've got to go more often. And then the urinary tract infections due to a loss of the barrier and your protective layer. Clitoral changes, very little, but what we do see is decreased sensitivity in the clitoris and shrinking, which also then affects your sexual ability. Now, what causes all of this is a question that I think everybody will ask. And the first cause will be, you don't have estrogen. The vagina loves estrogen. So a drastic reduction in estrogen produced by your ovaries is responsible for maintaining your estrogen is responsible for maintaining that elasticity and thickness and lubrication, and a drastic drop in it will take it all away. The second thing is with age, our quality and quantity of collagen reduces, and that affects the structural integrity of the tissue, making it less lax, more rigid. There's a reduced blood flow. Once again, reduced estrogen. Your body thinks the tissue is not important and it doesn't send the important blood to it anymore.
Okay.
And that makes it dry, insensitive. You don't feel anymore. The tissue becomes pale and thin. So imagine if you have less blood flow to your heart. That will lead to a heart attack. So what you're getting here is a vagina attack because she becomes so delicate and fragile. Then the same thing, because of the estrogen levels that are low, the mucus that is absent, the tissue that is dry, the pH will change. Now the vagina loves acid. She doesn't like high alkaline conditions. I will talk a little bit about pH in following questions.
Yes, yeah.
But if your pH has got the correct acidity caused by the lactobacilli that your vagina must have, then you are free of infections. But once that acidity starts to rise and it becomes more alkaline, it provides a perfect environment for bacteria to grow.
So you did mention estrogen, and we spoke about the estrogen decline in our previous conversation as well, and it's very clear that estrogen runs the show, right?
It does.
So how does that decline in estrogen very specifically impact vaginal health and very specifically the lubrication within the vagina and the pH balance and just the overall vaginal health?
Right. I'm going to quickly recap what I've just said. First of all, thinning of the tissue, which we call atrophy. It makes it delicate, irritated, and prone to tearing. Then loss of elasticity and size, as I've explained. The vagina is like a concertina. It must be able to stretch out, and you lose that stretchability. The reduced blood flow, once again, will cause the tissue to thin and reduce your sensitivity. You're prone to inflammation with reduced blood flow, and the vulva changes, like the external changes we've discussed. The second thing is the most important, is the impact on lubrication. My girls, dry vaginas are unhappy vaginas, and she will become your enemy and not your friend. So estrogen should stimulate your cervical and vaginal glands to produce fluid, and now it stops doing that. That leads to increased friction with micro tears, increased infections. And then there's the delayed arousal response, because the tissue doesn't want something there. It's almost like putting your hand on the stove. Your brain will tell you not to do it again once you've burned yourself.
Yes,
So you'll lose your libido, because once it's sore, your brain will tell you, don't do that again.
Yeah.
The vagina loves a low pH. So before menopause, with an acidic environment where your lactobacilli can thrive, and they produce lactic acid, your vagina will be healthy. And when the lactobacilli starts to disappear due to a high pH, your vagina will be unhealthy, and there will be a loss of the good bacteria with the increase of the bad bacteria. And a higher pH will then lead to a higher infection risk. Spontaneous infections, not necessarily induced infections.
What causes the pH to change? Is it just the lack of the
It's the
decline in
lack of
estrogen?
lactobacilli.
The lack of, okay.
But that the lactobacilli can only thrive in an acidic environment, and that is the estrogen and the vaginal secretions that provides that acidic environment.
So the lack of estrogen just messes around with our bodies from head to toe. Now there's a term, short it says GSM.
GSM.
And it stands for, I hope I'm going to pronounce this correctly, genitourinary syndrome of menopause.
Very close, my friend.
Okay.
Genitourinary syndrome.
Oh, okay. Now, it sounds like a very big word, and it sounds a little bit overwhelming. So what does GSM mean?
GSM, genitourinary syndrome, is just a new medical term because we're trying to be fancy.
Okay.
Previously was known as atrophic vaginitis, the thinning of the tissue. But it was introduced to describe that it's not just the genitals, it is the urinary tract as well, where the previous term vaginal atrophy only included the vagina. So this whole complex in your pelvis includes bladder, urethral, and vaginal health, and that's where this comes from. So there's physical changes, like you said, like the vagina gets thinner, the urethra also becomes thinner. The symptoms is, as we said, dryness, itching, irritation, painful intercourse, urinary urgency, and a recurrent tendency to UTIs or urinary tract infections. It significantly impacts quality of life. It reduces sexual satisfaction, and it puts a strain on relationships. The most important thing that I want to stress here is that unlike the symptoms of menopause, like your hot flashes and mood swings, that will eventually subside spontaneously if you choose not to use hormone therapy, the GSM will increase and become worse with age. It never subsides or get better. So as you age, it will only get worse. I'm going to quote an Afrikaans saying here. Jy mag 'n ou vrou wees, maar jy mag nie 'n ou vrou met 'n nat broek wees nie.
Okay.
It is underdiagnosed for many reasons. And the most important one is a reluctance to discuss. We are not always open. Many women feel embarrassed and uncomfortable to talk about their sexual or genital symptoms. There's also the normal aging myth that everybody accepts this is what it is. It's not a disease. This is your body. It ages. It's like wrinkles on your face. You either accept it or you don't. But everything can be managed.
Yes.
And we can control it. So it is an inevitable part of ages. But it's mostly a treatable condition.
That's the most important word. Treatable.
Treatable.
Yeah.
Yes. So there's a lack of screening. So overall, healthcare professionals don't always think this is important, as we've got so many other health issues in South Africa, like cancer or HIV or tuberculosis. Some other conditions always gets preference.
Yes.
A woman's blood pressure or cholesterol, and then we forget about our friend, the vagina. Okay. Once again, this is a progressive thing, and unlike menopause, this will not disappear spontaneously. Your hot flashes might go away, but your vagina will become drier.
Sure. Okay, so that's not necessarily good news, but there is solutions. So what are some of the most effective treatments for women that do struggle with a dry vagina or with vaginal discomfort? And if you can please share what are some of the hormonal solutions and what are some of the non-hormonal solutions as well.
Right, so GSM is highly treatable, and it's got non-hormonal and hormonal management. So we can start with the non-hormonal. You get over-the-counter lubricants for sex, and there's moisturizers for daily comfort, and there's vaginal probiotics that is available. So the probiotics introduces that lactobacilli back into your vagina. Lubricants for sex, please make sure that you buy a reputable brand. Careful of internet products. Moisturizer, also reputable brands. So I will go to a pharmacy or a health shop for these intimate items. Then hormonal. This is, ladies, the gold standard of maintaining vaginal health. So a local low-dose vaginal estrogen, which is available over the counter without prescription because of its safety. It comes in creams or tablets or little pessaries. It is highly effective, extremely safe. It provides no systemic absorption, so even if you have breast cancer or any other contraindications for using systemic estrogen, you may still use vaginal estrogen. The fact that our SAPRA allows this to be sold without prescription proves to the safety aspect of the low-dose estrogens. Low-dose vaginal progesterones also work, but it's less effective. And then there is the dihepiepiandrosterone, or as everyone knows, DHEA suppositories. It is very safe, but less effective than estrogen because your body has got to transform that DHEA and progesterone into estrogen. It's an extra process. And if your vagina is extra dry, that process of transforming those products might not be as effective as real estrogen.
It just takes longer.
It takes longer.
Work.
Like, then there's other therapies that I want to discuss. So there's laser therapies, and specifically if you go for vaginal laser, it's got to be a carbon dioxide or CO2 laser. This works the same as laser on the face, like a facial peel. It stimulates collagen. It will increase the elasticity. These treatments are expensive. They work. It will be an out-of-pocket. Your medical aid won't pay for this. And it is not permanently. So if you do laser therapy, follow that up with the estrogen therapy for maintenance. What works very well is vaginal hyaluronic acid, as everybody knows, HA. Now, if you have been using hyaluronic acid on your face, you will know the beneficial effects of anti-aging. This also works in the vagina and is available readily. There are several products over the counter, on the shelf. You don't even have to ask for it, or on the internet. There is also a treatment, and this one I'll have to name by name. It's called Caress flow.
Okay.
Many physiotherapists have this machine. It's hyperbaric oxygen that they combine with hyaluronic acid. And in severe dryness, this helps for that immediate effect, and you follow up that course of treatment then with estrogen.
Okay, but it's very good news to know that there is solutions out there.
Absolutely.
And I mean, like you said, you can go into the pharmacy and get it off a shelf. You don't even have to ask anybody, so you don't have to suffer in silence. But I think a lot of women don't necessarily know what's the difference between a dry vagina or an infected vagina or just an irritated vagina. So can you please explain to the listeners, how will they know the difference?
Right. Right. Very, very good question, Janine. So vaginal dryness is usually characterized by a lack of moisture, a stinging, a soreness, and painful intercourse, and often this will occur during menopause, not in young women. Infections are typically accompanied by a change in your discharge, very strong odors, ulceration on the skin, and with infections, if it becomes systemic, you will feel ill. You might have a fever, or you might have lower abdominal pain associated with it, or swollen glands. Right, Janine, so here's a breakdown of how to differentiate between the causes. Vaginal dryness, or what we call atrophic vaginitis, the symptoms are stinging, itching, and this is specifically around the vaginal opening or on the vulva, mostly exterior type of symptoms. The key indicators here is pain or bleeding during or after sex, and a feeling of soreness rather than a localized intense itch. And then in general, just a discomfort, almost like you want to wiggle yourself all the time. But yeah, not severe. Discharge, usually none, but there can be a very light watery discharge, or even some vaginal bleeding from the dry tissue. So a yeast infection, or medically candidiasis, the symptoms are intense itching, and there should be redness and swelling of the vulva and the vagina.
Okay.
There's usually a discharge with it, and it's a thick, white, clumpy discharge. It almost looks like there's a little bit of cottage cheese.
Yes. Yeah.
Right. The odor, there's usually no odor, but you can have a mild yeasty smell. That's sort of the same smell if you have an old bread in your bread bin and you open the packet.
Yeah.
The symptoms are often very quick to start, and it worsens very quick without treatment. So this is not long, chronic, low symptoms. Right, so bacterial vaginosis, or BV as we call it, the symptoms are very mild itching and burning, sometimes no itching at all, but it comes with a thin, greyish, sometimes greenish, bubbly discharge or foamy, very watery. You will be wet.
Okay.
So it's a very watery discharge, and it's got a strong odor.
Right.
It's got almost a fishy smell. So you will know when you have BV.
Okay.
This one doesn't hide herself. And that odor is usually pronounced after intercourse, or especially during an episode of a menstruation. This one is most commonly due to the pH problem,
Okay.
because of a lack of lactobacilli.
Yeah.
Right, and then there's other irritations, like what we want to call contact dermatitis. So it might be a soap that you use, or underwear type, or a pad that you use that you might have a light sensitivity to. That usually is exterior redness, stinging, itchiness of the vagina and the external genitalia. A key factor is the symptom will appear after you've used a product that you're sensitive to.
Yeah.
So old products, if you haven't changed your soaps and you haven't changed your underwear or you haven't changed your regime, you will not have contact dermatitis, unlikely.
Yeah.
And the itching usually stops when the irritant is removed. It does not require treatment.
Can I quickly circle back? You said with vaginal dryness there can be a little bit of bleeding.
Yes.
When does the bleeding become risky, or when does the bleeding become a problem that the woman needs to go see a doctor?
Very good question.
Yeah.
So vaginal bleeding during the menopause could be a sign that you might have a lesion higher up, like on your cervix. It could be a sign of cervical cancer,
Okay.
or it could be a sign of endometrial or uterine cancer. So all bleeding that doesn't stop, or all bleeding that is unprovoked, must be checked out.
Okay.
Usually the bleeding that occurs due to the dryness comes after an incident of provoking, so either you had another infection and then the tissue cracked and starts to bleed, or you had intercourse and the tissue broke because of the friction and it bleeds.
And that's a short-term
It
bleeding.
is
That's like a
very
day
light,
or,
and
yeah.
it spots.
Yeah.
If you haven't had a menstruation for a year and you bleed pads full,
Okay.
that is not from atrophy.
Yes, I think that's a very important differentiation that they need
Yes.
to know. You did mention urinary tract infections, and you also mentioned the yeast infections. That's something that I see very regularly at my practice as well as a kinesiologist. What are some of the things that women can do to prevent those recurring incidences?
Yes. So we've talked about why these increase. Once again, it's the declining estrogen, it's the lack of your beneficial bacteria,
Yeah.
it's the physical changes that you get, the lack of collagen. One can develop prolapse. If you have prolapse, some of the urine might stay behind in your bladder and never empty and create a space for bacteria to multiply. Incontinence with a gaping urethra can allow for bacteria to enter and sexual activity. So how do we prevent this? First of all, estrogen, estrogen, and estrogen. And this is topical application.
Yes.
So the vaginal application of
Yes.
estrogen. Hygiene habits, very important. Avoid douching, because if you wash your vagina, you upset that bacterial balance. It's also the way you wipe yourself when you go to the toilet, always front to back. That's how we
Yes.
avoid. And urinate immediately after intercourse to flush out the bacteria. So lifestyle management, maintain a good blood sugar, especially if you have diabetes, as high sugar levels will change the pH level and promote yeast growth.
Yes.
Right. Probiotics, I promote the use of probiotics that contains lactobacilli, and there's a lot of vaginal preparations with probiotics. There is a new vaginal preparation that's available that contains estrogen as well as lactobacilli, and you may ask your pharmacist about that product.
Right.
That helps to support your vagina, preventing candida, atrophy, and BV. In medical evaluation, if you are not sure what is happening, please don't treat yourself and see a medical doctor, because sometimes you might need prescription medication.
Yes, and I think also the sooner the better. Don't sit on a problem and
Yes.
let it become worse. Make that appointment, go see your doctor, get help. Now, a few weeks back, I had a guest on the show. We talked about pelvic health. And I would love to get your opinion on that as well. So how do pelvic floor changes in midlife affect vaginal pain and leakage? And by what time or what point should a woman go to find professional help?
Very excellent questions. So we've talked about the reduced estrogen that can weaken the tissue, and this weakness in tissue can cause your pelvic floor muscles to become weaker. As we age, all our muscles become weaker. The same as your biceps or your triceps, that will not be as strong as when you were 25. Your pelvic floor will also weaken, and that can lead to a bit of prolapse of the bladder, where your bladder starts sagging. It can lead to incontinence. We also have what we call the middle age spread, which is a natural weight gain that women experience around their waist during menopause, but that causes increasing downward pressure on the pelvic floor and can push the pelvic organs downwards, causing prolapse.
Yeah.
Then the reduced blood flow. As I said, you need your blood flow for healthy tissues, and without exercise and stimulation, as with the rest of the muscles in your bodies, the atrophy worsens. So the common symptoms of this pelvic floor dysfunction that develops spontaneously in midlife is leaking of urine. So there's two different types of leaking and another little mixes of it all. I'm just going to talk about two.
Okay.
The first one that happens, and most commonly, especially in women who had vaginal births, is stress urinary incontinence.
Okay.
This is an involuntary loss of urine when you have not emotional stress, but strain on your pelvic floor, like a sudden cough or a sneeze,
Okay.
or you bend to pick up something heavy,
Yeah.
or you have a full bladder and you get up from the chair and you feel some leaking. Then you get urge incontinence. The urge incontinence doesn't necessarily come with an action of pressure on the pelvic floor. It's when the bladder is full. If that urethra is too thin, as previously mentioned, it cannot withhold the pressure from the bladder, and you'll get that sudden urge to wee, and sometimes you can't control it. So if the muscles are weak, like if your bicep is weak, you will not be able to pick up something heavy. If that your pelvic floor is weak, you might not be able to have a proper pinch to stop this flow. So the prolapse we've discussed, it's often felt as a bulge in the vagina because of a descent, and that is due to a weakness in the pelvic floor. Painful intercourse, mentioned many times. Also chronic constipation and straining, because your rectum sits at the back of the vagina, and if it starts to get, you don't have that elasticity, there's no proper propulsion, and women start to strain. The infections we spoke about. So a good question, when to see your pelvic floor physiotherapist. Now physios, like medical doctors, start to specialize now. This one only does necks, that one does knees, and now we have many specialized pelvic floor physiotherapists. So it's never too late to start. Early intervention, always the best. So when you have persistent symptoms like leakage of pain or heaviness, lasting for a few weeks, and your own exercises proves to be ineffectual, then you go see your physio. Pain with intimacy, physiotherapy, it does wonders with techniques and stimulation of the vaginal tissue. As said, if you have a lack of success with independent exercises, if your Kegels that you do at home or the ones that you follow a video online doesn't work anymore, it's good to see a pelvic floor therapist, because sometimes when you think your tissues are too lax, it might actually be too tight. It has the same symptoms. It's dysfunction. So you might need a physio to loosen some tightness for you.
To de-stress.
To de-stress your friend. And obviously before or after any gynecological surgery, it is a very good idea. Hysterectomy or bladder repairs or vaginal repairs, it's good to consult with your physiotherapist before and after surgery.
And helps with the recovery.
Absolutely. Helps with effective recovery. What does a pelvic floor physiotherapist provide you? So contrary to popular belief, it's not just doing Kegel exercises with someone. Specialized physiotherapists provide tailored assessments. They are trained to do internal pelvic examination to determine whether it's a weakness or an overactivity in your pelvic muscles, because the overactivity can also lead to this urge to urinate quickly. They can do manual therapy, and they are licensed to do manual therapy on vaginas. techniques to release tension and techniques to increase blood flow to the vagina. They can also work out a personalized exercise, customized plan for you, focusing on coordination, endurance, and strength, which your self-help techniques and a video from the internet might not be able to provide. They're also excellent in providing behavioral advice, techniques for improving bowel or bladder habits. So I want you to take note, pelvic floor physiotherapy is highly effective, especially if you take this in conjunction with a local estrogen, which is safe.
Yes. So what's great about that is if you know there's a specialist physiotherapist, I think the ladies would feel so much more comfortable to go and talk to them. It's not, you don't need to feel like it's a sensitive topic, because that's what they do.
It's nothing to be embarrassed about. We want to actually register them as gynecological physiotherapists. It almost will make access easier for patients to see them, but currently known as pelvic floor physiotherapists.
We are glad that we have them.
We have them.
So what are some of the lifestyle factors that can impact our vaginal health and our pelvic health?
Right. The breakdown of key factors, and I think the most important is exercise. Regular physical activity improves your blood circulation in total, and that maintains tissue oxygenation, elasticity, and muscle tone. Overall, if you walk regular, your pelvic floor will be better. If you do yoga, your pelvic floor will be better. But then, specific pelvic floor muscle training, your Kegels, but yoga, Pilates, all provides that pelvic floor exercises. It gives that flexibility. What yoga and Pilates and running and walking and exercising also does is it reduces your stress levels and it reduces your cortisol levels, which improves your overall vaginal health and your muscle tone. So cortisol is an important thing that we'll talk about a little bit later. Weight-bearing exercise, especially walking and running, will also maintain your weight and your weight management and will then provide less strain on your pelvic floor.
So if you aren't motivated to exercise, maybe having a much healthier vagina would be the motivation to start exercising.
Secondly, I want to talk a bit about stress management. So chronic stress produces high cortisol levels. High cortisol levels will cause a sugar imbalance. That can further lower your estrogen, and the sugar imbalance can higher your pH and completely disrupt your vaginal flora. So cortisol and vaginal health does not go together. So your elevated cortisol, the high pH, low lactobacilli, all your good bacteria need for a healthy vagina will disappear and the bad bacteria will have the opportunity. And this is your BV and your yeast infection. So it's good adrenal support. People always ask about it, is this a myth or not? Adrenal support mostly you will get from exercise and lifestyle changes, but there are some health practitioners who can provide you with adrenal gland support to reduce the chronic stress and adrenal gland secretions and lower your cortisol levels, because that will increase your natural estrogen levels. So once again, general exercise or yoga, mindful meditation, all to help maintain a healthy, balanced vaginal microbiome. Then there's diet and nutrition. So a nutritious diet with low sugars helps maintaining a healthy body mass index. And it also reduces your inflammation that can increase dryness and bladder issues. What I recommend is that if your diet doesn't have enough omega-3s, that you should start to take omega-3. Omega-3 is a very powerful anti-inflammatory. I don't like to introduce necessarily a tablet or a pill or a supplement for everything. You
Yeah.
can include this by good oils,
Yes.
fatty fish, good nuts in your
diet,
diet,
yeah.
and that will increase your natural lubrication. Also, hydration. If your lips are dry, your vagina is dry. So if your lips are dry and you drink more water, they're not dry anymore.
Yeah.
The same happens to the vagina. And then limit irritants to the bladder. Now, there's a long list of things that you can go and Google and search and see what can irritate the bladder. But the most common thing in our society is caffeine, alcohol, and sugar. That
Yes,
will increase your urgency, frequency, and overactive bladder symptoms.
So those are all your acidic
That's
irritants.
exactly. But also caffeine and smoking and alcohol is a direct bladder irritant without changing pH or without, because this is all excreted via the urinary tract and will go line your bladder and irritate it. Right, and then sleep hygiene. This, once again, sleep deprivation raises your stress cortisol, and then that worsens your hot flushes, turns to more sleep disruption, more cortisol, and the more cortisol you have, the higher your body mass index will be, and the sadder your vaginal will be. So restorative sleep and good sleep is very important. Then seek help if your symptoms worsen or cannot be controlled by your own management.
You know what's amazing to me? In all the topics that we talk about on the show, it comes down or back down to the basics. The basic pillars of health: eat well, sleep well, hydrate, exercise.
Exercise, absolutely.
And people don't necessarily understand that how extremely important those pillars are.
They're very important. Remember, your vagina is an organ, like your heart, like your kidneys, like your liver. It needs the same as any other organ to maintain health.
Yeah, interesting. We have alluded a lot now to the sexual discomfort that women experience during this phase of transition, during midlife, right? So there's sexual discomfort, and you did mention earlier there's a less desire for sex, so low libido. How do perimenopause and menopause contribute to those changes? But even more importantly, what else can we do? You did say that there is estrogen, localized estrogen available, but what else can we do to get comfort from that?
Right. So the effects of menopause on sexual function, we've touched lightly on it. Estrogen, estrogen, estrogen again. The tissue is thinner, drier, less elastic. It leads to burning, itching, pain, and infections. So when you have something that hurts you, one starts to avoid it.
Yes.
So your low desire or your low libido is multifactorial. It is not just low estrogen. It is lower estrogen and lower testosterone, which is natural in a declining ovarian function environment, can reduce your interest in sex. But most important, factors like hot flushes and sleep disturbances, mood shifts like anxiety and depression can further decrease your libido. Your sexual life is something for your enjoyment. And if you don't enjoy it anymore, it's something that you will avoid.
Yes.
It's like a roller coaster ride. When you were a kid, you loved it. Now that you're older, it's like,
No,
I don't want my
you.
tummy to turn like that.
Yeah.
So you don't get onto that roller coaster anymore. So the reduced arousal that we get is due to the reduced blood flow. So slowly to arouse, the genitals doesn't respond so quickly because of a lack of sensitivity and a lack of blood flow, a lack of moisture. So your foreplay must become more interesting or maybe a bit longer, because it will take you longer to get to that point where you feel aroused. A quick form of arousal, I said to my husband, is I'll scream for a diamond. So your husband has got a role to play here in your arousal. And I think this is something couples need to discuss.
Yes.
Like, he should treat you like he treated you many years ago.
Yeah.
And court you again and make you want him. That's part of intercourse, is the illusion of the eluding factors leading to intercourse is making you want it. So this is something couples need to discuss. There's mental and emotional factors. So as we get older, there's a change in body image. You might not want to undress, and then we avoid it. You might be stressed or become anxious or depressed during menopause, and you can be extremely fatigued, and that will lead to a lack of desire. So menopause and fatigue, you know, sexual activity is like exercise. So when you're extremely tired, you're not going to run and exercise. So there's another exercise your body immediately avoids, and that's sexual intercourse. Because that's not a passive thing we do, it's a very active thing. So you need to have the energy to do it as well. Then there's chronic disease and medication that we all get. Hypertension, as I said, depression, all certain blood pressure medication, pain medication, psychiatric medication. Their side effects are a decrease in libido. And that's because it affects the nerve transmission and how your brain talks to the rest of your body. So pain blockers all reduces nerve function. That's how it relieves your pain. But it will actually decrease a lot of other sensitivities as well. So how to improve our sexual health? So the local ones we talked about, it's lubricants. So for older women, I suggest not to use a water-based lubricant, but rather a silicone-based lubricant. Oils do work, but it's very messy. And using a Vaseline or a baby oil or a coconut oil is not always body friendly or vaginal friendly. So I'd rather go for medical based silicone, which is researched well. It lasts longer than the water based, but any lube will do. There's vaginal moisturizers, plenty available. Like you would moisturize the rest of your body. There are specifically designed vaginal moisturizers, which you can find in your supermarket where you find other female hygiene products that can be used.
And that can then be used daily. That's not just for when you want to.
Yeah, that can be used daily. Then there's, again, the topical vaginal estrogen, and I'm not going to go into that again. I think we've talked about that. There are systemic treatments as well. If you treat your menopause with systemic hormonal therapy, it will take away, you will sleep better, it will take away the fatigue, your hot flashes will improve, your weight management will improve, and your vaginal health and overall quality of life will improve with systemic hormonal treatment. There's also testosterone therapy. Here I want to warn against the use of compound medicines. They are not registered in the general market. There are prescription testosterone that is proven to be safe for women available, but you will need to see a doctor for a prescription of these androgens. And they help for women who have a low libido despite doing everything else. So I don't think testosterone should be a first-line treatment, but it does help for the woman that has done the exercises, that has done the creams, the moisturizers, the estrogens. There comes testosterone and plays a role. So lifestyle and other interventions, we've mentioned pelvic floor physical therapy, that works. Then there's regular sexual activity. Now, this does not necessarily mean a sexual partner. One can have regular sexual activity by yourself. There is a lot of what we call vaginal dilators available in the market. One can go to medical websites to obtain them, or a simple vibrator can do the same. So regular activity in the vagina gives you consistent stimulation that will increase the blood flow. The vagina is a lose it or use it organ. If we don't use it, you're going to lose it. And once that elasticity is gone, it is very difficult to get that stretchability back again with your dilators.
And that's so contrary to, like you said earlier, the moment women start feeling discomfort, they don't want
They
to
want to avoid.
Yes.
Yes.
And now you are saying, no, please don't. Please don't.
Please don't. So if you're uncomfortable with your partner, do self-stimulation with maybe an item that is smaller than your partner until you get that relaxation. One can also do the self-stimulation immediately prior to sex to get you into that sensitivity and increased blood flow state that will increase your arousal.
Yeah. Okay.
Sex therapy. There's a lot to say about sexologists. This counseling improves communication between you and your partner. There's a lot of avoidance. The partners don't understand and think the love is gone. We need to reframe how we approach this with our partners, and that's where sexologists come in. They also can help reframing your thoughts on your aging body and your body image and how to explore new sexual techniques. An older body cannot run the way a younger body is run. An older body cannot have sex the way a younger body. So there might be a different position suggested to you by your sexual therapist.
Yes.
And then healthy habits, we've talked about that. Activity, stop smoking, reduce alcohol, and that can improve your libido as well. So summary of our tips, be patient, it might take longer to get aroused, always use lube. Dry sex, very uncomfortable, it leads to tearing and it leads to infections. Talk to your doctor, a sexologist or a gynecologist, and they can help you distinguish between physical or psychological issues with libido. And then explore options. If one treatment doesn't work, try another one.
Yes.
There are so many.
Yeah. The thing that's so prominent here is that just because you are now in perimenopause and menopause does not mean that you have to stop having a sex life. You can absolutely have a wonderful, full life despite the phase where you are in. And there are so many options available. That's wonderful to know. So Bianca, we've talked about so many aspects about vaginal health, pelvic health, the role of estrogen, what we can do. Now, just to draw this conversation to a close, what are some of the myths around vaginal health and menopause that you wish women would stop believing?
So there are several myths surrounding vaginal health during the menopause transition. Clearing these myths up can help women seek the right care and maintain a healthy quality of life.
Yeah.
So number one, the vaginal symptoms will eventually go away on its own. This is not true. Unlike your hot flashes or mood swings, irritability, the vaginal symptoms will not go away. It will become worse without management. And you might have a permanent decline in function, either sexual function or bladder function or bowel function. Once again, jy mag nie 'n ou vrou met 'n nat broek wees nie. Then, myth number 2. Itching or dryness always means that you have a yeast infection. So while itching is the classic symptom of a yeast infection, it's frequently caused by other factors. So there are many culprits like your atrophy or irritations from soap or detergent or wearing tight-fitting, non-natural fabric clothing. Be very careful if you itch to treat with over-the-counter medication. I've got no issue with a woman that knows that she's got candida, that knows what treatment to use and uses it and it works.
Yes.
But to see a patient that comes to me and tell me, doctor, I've had 6 courses of yeast infections treatment and it didn't work. My yeast infection doesn't go away. Then I'm like, if one course doesn't work, you don't have a yeast infection. It should work. So if your itching doesn't go away after treatment, you don't have a yeast infection. Number 3, all vaginal discharges is a sign of infection. That's not true. A discharge is the way of the body to clear and clean debris and old cells from the body. Now, your skin will shed some cells, your vagina will shed some cells, and that will come out as a little bit of a discharge. So a normal discharge in a vagina is usually clear, white, can be a pale yellow, and it can vary in consistency from watery to a thick or creamy discharge, depending on where you are hormonally.
Okay.
The less estrogen, the more watery, the more estrogen, the more creamy it will be. Right, so a healthy discharge actually protects your tissue from infection by causing that lubrication and maintaining a slightly acidic pH. So a discharge without itching, burning is normal. So if you see a spot on your underwear or a pad, and even if it occurs every day, that might be normal and a physiological discharge. Then the fourth myth, and this one gets me. You know I love estrogen.
Yes.
And women who thinks that vaginal estrogen carries the same risks as systemic estrogen when it comes to a woman who's had a blood clot or a heart attack or a woman with breast cancer. It is not the same. The vagina is not made for absorbing medication. That's why most medications are not administered vaginally. It will only, the estrogen will only work locally and is absolutely very safe to use in most conditions. If you're not sure, do ask your doctor if you may use vaginal estrogen. And I'm sure most will say yes. Another one is that your vagina needs special products to deep clean. That is not true. The vagina is self-cleaning. It maintains its own balance of good bacteria. So from a lot of internal washing and using soaps in your vagina and douches containing alkaline products, that will destroy your good bacteria and it will increase your risk. So even if you do have an infection, rather use the medication, but don't wash.
Yes.
One will wash out your good bacteria. So you don't need to wash out. Occasionally a medical doctor, when there's a sore, like we will treat septic sores on our skin with a topical or a antibiotic cream or a cleansing agent, a medical cleansing agent. So occasionally your doctor, when there's an ulcus, might tell you to use a harsh or a medical soap to wash your vagina, but that's to wash sores and ulcers, not for general maintenance. So proper care of the vagina is, if you want to rinse, just use warm water and or a fragrance-free vaginal gynecological approved cleanser. So just a few small ones. There are people who think that sexual activity can damage your vagina because you see the bleeding and then you think you should stop. And we've just discussed that. Sexual activity improves health of the vagina. It improves the blood flow. It improves the elasticity. So if you have a little bit of a bleed or an injury during intercourse, don't stop. Seek advice on how to do the sexual activity and proceed. So you will not injure yourself permanently. Then people think that incontinence or losing urine is normal. Like all our grannies smelled like urine, so it must be normal. It is normal, it does happen, but it's a very treatable part of aging. You don't have to leak urine. And the options, as mentioned, is pelvic floor physiotherapy. There are pessaries that you can use, and then the medications, as mentioned, to prevent leaking. Always seek help. And then lastly, the myth that I hate most is a healthy vagina has no odor. Now, we all have specific body odors, and your vagina can have a healthy scent, which you may be aware of. But I want to assure you that people around you, unless there's a direct sniff, will not be aware. So other people can't necessarily smell you, but you might be aware of your own body odor. So a healthy scent is often described as a musky or tanging or earthy type of smell, and that is normal. That is not an infection. If you don't burn and itch, but you have a slight odor, that is normal.
That's okay.
That's your body. So when do you need to worry about an odor? When it's a very strong, very persistent, foul or fishy-like type odor, then you consult a medical doctor.
Dr. Bianca, thank you so much for busting those myths, because giving us the contrary information, keeping us informed, brings a sense of calm, and it brings, it makes us empowered. And I just want to say thank you so much for your time today and for sharing the knowledge that you have shared today in such a beautiful and direct way, because I think that's the only way that we can have this discussion, is point on. So I appreciate you, and I appreciate you being here. Thank you so much.
What a pleasure. Thank you, Shanine, for once again inviting me. And thank you so much for informing women.
Oh, thank you. Can you please just again share your contact details if you are comfortable, if anybody would like to get in contact with you?
Right. So my office number is, my office is based in Pretoria at the Life Groenkloof Hospital in Groenkloof. The office telephone number is 012-346-4564. You can also contact us via email, and that is admin@drbzondach.co.za. Thank you.
Thank you. I will definitely add that into the description box. And I think one of the biggest takeaways of today's conversation for women is that they don't have to suffer. They don't have to sit with any discomfort. There is solutions.
Absolutely.
Thank you. Now, if today's conversation resonated with you, if you recognized yourself in the dryness, the discomfort, the exhaustion, or even just that quiet feeling that some things are changing, I want you to know this. You are not broken. Your body isn't failing you. It's just communicating with you. And midlife isn't about pushing harder or ignoring symptoms. It's about learning how to work with your body differently. So if you are ready for personalized support, this is the work that I do as a health coach, a kinesiologist, and a Tory practitioner. I help women in perimenopause and menopause understand what their bodies are asking for, support their nervous systems, hormonal health, and metabolism, and move away from shame and confusion to clarity and confidence. You don't need another quick fix. You need support that sees the whole you. So if you'd like to explore working together, you can find my details in the show notes, or you can visit my website at www.dienucare.co.za. And as always, please remember, you are worthy of care, comfort, and feeling good in your body at every stage of life. So please take care. Until next time, God bless.